tal? Estamos transmitiendo en Solane 2025 y estamos conociendo algunos de los partners que están aquí disponibles ya para platicar con todos los doctores, para informarnos un poco más acerca de lo que están haciendo, el trabajo que están haciendo ellos acerca de las enfermedades neuromusculares. Y me encuentro ahora con Matt Watkins, quien viene de ChilliPharm y nos va a platicar un poquito acerca de su proyecto. Hi Matt, welcome and really happy to have you here in Mexico.
Yeah, good to be here.
Yeah. And I would like to know a little bit about what you do and how you got involved in the diseases.
Cool. Yeah. So what we do, we support sponsors and sites who are involved in neuromuscular disease studies, and our particular role all centres around video. So apt that we're doing a video, but we make it possible for sites to create video of patients when they're taking part in functional assessments. So those are things like 6-minute walk tests, North Star ambulatory assessments that get used in clinical studies for sponsors and regulators to work out if a drug is having a positive effect on a patient. So they get them to sites to carry out these assessments on a regular basis. But one of the most important things with those assessments is that all the sites carry the assessments out consistently. And the way they can demonstrate that is we send a filming kit which looks like that, and when you put that filming kit together, it looks like that.
I'm going to move to this side, so that we can see a little bit.
And those filming kits are used by the sites, so when the physiotherapists are carrying out the assessments, they're videoing that on one of our filming kits. That video then gets uploaded to our platform, which is called ChilliPharm, so the video can be reviewed and commented on by experts. And at Solane, we are co-hosting with our friends from Atom, and Atom are those experts. Atom are the guys that know more about the correct way to carry out those assessments than anybody else.
That's very interesting to see, like the tech side of this in this congress. And I would like to just get a bit closer, just that we can see the iPad and we can see the tablet, and we can see. Like, you can explain a little bit of how this works.
Yeah, sure. So what the kit you
Sorry.
send to the site
Wait.
Oh, sorry, guys. The kit that we send to the clinical sites, when we ship it, it arrives in this packaging. And the clinical sites that work in these studies are very used to receiving these. They'll have several. And when they put the kit together, they've got an iPad, and the iPad will carry study branding. There's an iPad mount adapter. And we have our own tripods made, professional standard tripods. We have those manufactured so that we can type certificate them to make it possible for us to ship them all around the world. And the sites use the iPad because an iPad's something we think everyone knows how to use, so it's not daunting for them like maybe a professional camera would be. And they use the iPad to film the patient. You know, if it's DMD, it'll be a boy doing these function assessments with the physiotherapist. And those videos have become increasingly important to our clients, who are the sponsors, but also the users of our platform, which is the hospital sites. And it's so they can demonstrate that everyone's doing the assessments correctly, and most importantly, they're doing it consistently, so the data is valid. It's very important. Yeah.
Because otherwise, it would change like in each patient, right?
Yeah.
Mm-hmm.
Yeah.
And what can you say about the clients that you have in Latin America, and is it a different situation than in the UK or other countries?
Well, actually, it's something we're trying to resolve. We don't have many Latin American-based clients. We've got quite a lot of Latin American-based sites who are involved in studies, and those studies are usually run by US-based drug companies, many of whom are here. So the users of our platform will be in sites in Latin America, but we're very keen to gain more business in Latin America, which is why we've flown out from London to be at this event. And we know our friends at Atom are keen also to encourage sites to be more on the radar of these companies, the big drug companies, so that they can get recruited to take part in studies, because that's beneficial to the patient population and those sites and the whole community of rare neuromuscular. So all in all, it's a bit of an initiative for us, and we're working with our friends at Atom to try and do more in Latin America.
Definitely. Well, it's been very interesting to talk to you, Matt, and we'll be continuing to report from here, and we wish you a pleasant stay in Mexico.
Lovely. Thanks very much. Cheers.
No se olviden de seguirnos en redes sociales. Nos encuentran en Facebook, Instagram y LinkedIn.